Hi, good afternoon, everyone. Thank you for joining us in our Facebook Live of Ask Charlie Anything. Today, our topic is going to be understanding ADHD. The speaker that will be joining us is our in-house clinical psychologist, Nurul Liyana. So she'll be here sharing with us about understanding what is ADHD or attention deficit hyperactivity disorder. So before I start, just a quick introduction. Okay, all right. Our upcoming workshop, we have Get Ready for School. It's a 3 hours workshop, free. It'll be held this Saturday, 9 a.m. to 12 p.m. Okay, you can register. You can check out our Facebook and register from there. And then next, we have a sensory stimulation technique by our in-house occupational therapist, Miss Alia. It will be on the 22nd of December, next Wednesday. Uh, okay, and then brief introduction about my story, who we are. Okay, we are a special need training center. We provide services for those who have academic delays, sensory delays, developmental delays, behavioral and emotional difficulties, as well as physical delays. So our team is consists of multidisciplinary. We have academic support, which is teachers, behavior therapists, clinical psychologists, a counselor, occupational therapists, reading therapists, and speech and language therapy. Okay, you can contact us here with our phone number and email. We provide free consultation. Okay, and then you can also check us out at our Facebook page, Mind Story, Mind Story Care Community Group, LinkedIn at Mind Story, our website, as well as Instagram. All right. So I would like to invite Ms. Liana, our clinical psychologist. Hi, Liana, are you there?
Yes. Hi, Charlie. Hi, everyone.
All right. Good. Can you hear me? Yeah.
Yes,
All
clearly.
right. All right. Okay. So the topic today, we're going to talk about understanding ADHD. Uh, all right. Last last month we talked about ASD, autism spectrum disorder. So this month we would like to talk about attention deficit hyperactivity disorder. All right. Okay. Let's start. We're going to start with basically what is ADHD.
All right. So last month we talked about autism spectrum disorder, right? So that is under neurodevelopmental disorders, right? So today we're gonna talk about ADHD, which is attention deficit hyperactivity on impulsivity disorder. All right. So this is also under the neurodevelopmental disorders as well. All right. So it's one of the characteristics that we often look in children below the age of 7 or below the age of 12. All right, mostly we can see as early as as early as below 7. All right, so this is what ADHD is. So later on I will explain what the characteristic of ADHD and what to look for, what are the red flag symptoms. All right.
Okay. All right. So it's one of the neurological disorder as well.
Yes, it
Okay.
is. It is.
All right. Can I know what are the characteristic of ADHD?
All right. So basically, ADHD, there are two domains or two symptomatic that we need to look for. All right. One is the hyperactivity, and one is the inattention. All right. So let's talk about the hyperactivity first. So when we talk about hyperactivity or impulsivity, all right, so you often look in children who have difficulty remain seated, difficulty in giving attention or full-time attention, difficulty in listening. All right. Sometimes when we talk to children, those who have ADHD have difficulty maintaining eye contact, difficulty having this proper listening skills. Maybe you haven't finished your instructions or directions. The child with ADHD has oftentimes go away, do their own things, not minding you and whatnot. All right. So this is the difficulties that we see in children with ADHD, the hyperactivity. And sometimes when we talk about hyperactivity itself, it regards the mental effort as well. For example, in school, if teachers give them school homeworks. So certain subjects require mental effort. For example, mathematics, right? So you need to think, you need to do problem solving, you need to have organization skills, you need to have planning skills. When you read especially the subjective question for mathematics, so you need to understand the whole paragraph, and you need to know what equation you need to use and things like that. So that requires planning or organization skills, right? And also comprehension. All right. So that also involve a lot of things for just one question. So children with ADHD have difficulty doing all that, right? Don't know how to organize the problem, don't know which one to start. So that sometimes that's why children with ADHD have difficulty starting or finishing or completing their homeworks. All right. So that will fall under the hyperactivity part. So now that those are some of the things in the hyperactivity part. So let's look at the inattentive part. So when we talk about inattention, right? So having difficulty paying attention, close attention to certain details. For example, in mathematics, you're supposed to do subtraction, but then you did addition instead. So things like that requires detail. So with children who have ADHD and inattention, who has the greater inattentive part, have difficulty following or giving details into that. All right. So not being able to focus, easily distracted. So when I say easily distracted, not just by, oh, someone is walking lah, oh, someone is just something there's a noise outside. So basically, when we talk about inattentive, is about when you get distracted, you are focused on that distraction instead of coming back to what you're doing. All right. So that's a part of inattention. Yeah. So those are some of the characteristics of ADHD.
Okay. All right. So basically, what I have heard is we look at two components, which is the inattentiveness as well as hyperactivity. So these are the two strong characteristics. If a child has ADHD, these are the two strong characteristics of ADHD. Okay, and also I heard that you shared a bit about the area affected in terms of school. Can you like briefly explain it again? Because there's so many things that you talk about how hyperactivity indirect or directly impact on a child. So you talk about the characteristic. You shared a lot about how the characteristic of inattentiveness as well as hyperactivity. But now, you shared a lot of example that can we break into like the how does it affect? We start with hypersensitivity. How does it impact on a child daily basis?
All right. So when you talk about daily basis, there's a lot of things for you to focus on, right? So let's talk about you want to talk about at home first, or want to talk at school first? Which areas that you want to talk about?
Okay, so which area do you think that we can observe the most? Is it
All
at
right.
home or at school? I believe school setting is the one that we
Yeah.
start with school because I think in my opinion that hypersensitivity or hyperactivity will likely to occur in school.
Right. You're right. Okay. So when we talk about school settings, right? Uh, it's often times that I get referrals from the teachers after they get into like standard 1 or standard 2, for example, because that's where the teacher observe those behaviors are not typical as other children, right? So the teachers detected and the parents were not able to detect early, all right? Because I'll let you know why. I'll let you know what the difference is. So when the teachers detect them, some of the teachers' complaints are, for example, unable to sit maintaining their seat, right? So especially when children who have ADHD, retaining their seat is very difficult. Focusing on the class is difficult. Focusing on the teachers to give information is difficult. Sometimes they will go roundabout in the classroom, standing up, disturbing other kids. So those are the things that we look at. So sometimes what is the difference? Sometimes parents would ask, okay, so that's probably might be a normal thing for a child to do in class, right? Because children cannot sit for such a long time. Yes, that's true. However, we need to look at the fine definition of hyperactivity, all right? Not being able to sit probably for more than 5-10 seconds, that's not something that you should consider as a typical behavior, right? Always disturbing other children, always disturbing the class. So that is also one of the characteristics when we look in the classroom itself, right? So me not being able to refrain themselves from talking in the class, for example, or when the teacher said, if you want to ask questions, you need to raise up your hands, then you can ask questions, or if you want to answer questions, you can do that as well, right? So with children with ADHD have difficulty restraining themselves from doing that. Most of the times, what they do is whenever the teacher has questions for other children, they tend to answer on behalf of the other children, right? Not only once, probably most of the time. So that's one of the things that the teachers look at. And probably if they have something to share, instead of waiting their turn to share their thoughts, they just blurt it out, all right? Not knowing the right time to say certain things. So those are the things that we need, the teachers, is obvious in the teachers' classroom settings, right? So when we talk about at home, right, especially during the MCO period, right, last time, so it's quite difficult for parents to identify, because this is one of the things I often get from parents. Why haven't I seen this behavior, or why is this diagnosis being carried out after they go to school? I mean, at home, this is a normal behavior for the children to behave this way. So those are the things that you, as parents, we need to look at the small details. So probably because you're at home now much longer than before, you've seen this behavior and you are normalized by this behavior. You know, kids being kids because they can't go out, they can't play with friends, they can't do certain things, all right? However, there are certain characteristics that we need to look at, not just because they are unable to focus, they're unable to sit down and whatnot, they are considered as ADHD. No, there are more to that. For example, if at home, unable to play quietly, for example, all right, so that's one of the characteristics. However, it needs to be in a duration more than 6 months and synchronized with other settings as well, not just at home, because they are caught up in at home, right? With provided with they are showing the same behavior at different settings as well. Yeah, so that's the difference between when they're at home and they're in the classroom settings.
Okay. So basically, what I heard is a lot of area will be affected uh, in terms of like they're having difficulty to comply, I would say, to school. So
Yes.
so it's easier to observe in a pool among a pool of students. We can definitely see the difference between the child suspected or maybe have a potential of a hyperactivity. We're not talking about ADHD. We just talk about a tendency of having the hyperactivity characteristic, which shared by Liana, as compared to at home, where you say that we tend to normalize. It can be like uh, I'm used to this behavior, so it should be. I mean, like any other kids. So yeah, I do agree with that. Or some of the parents, they only have one child. Even it's really hard to see because we have not that we are comparing uh, in a bad way. We just want to see like how our child progress or how they play, how they interact with other activities. Because like Liana shared also, it has to be consistently such behavior occurs over 6 months and synchronized, meaning that it's quite consistent at home and at school, and it happened for the last 6 months. All right, that's the hyperactivity part. Now we're going to talk about inattentiveness. Can you share
All
with
right.
us? Yeah.
So let's talk about inattentive. So inattentiveness or inattention in classroom, what you can see is whenever the teacher asks question, the students sometimes has these PC moments, or we call it berangan, this spacing out. So the children sometimes they have that moment. So whenever the teacher calls out the name, sometimes it's difficult for them to respond because they're in their own world, minding their own business, because there's distractions somewhere else that's more that's greater than the attention that they can give in the classroom. Or in the classroom, what we can see is that when the teacher is trying to teach something, they don't actually focus on the teacher. They're doing their things. But sometimes children with ADHD are able to catch on information through their auditory skills. All right. So that's where teachers are often kind of like disturbed that why is this child is not paying attention to me talking, doing around, but also at the same time able to catch on when we ask questions. So that's one of the things. Sometimes when kids they are playing, they don't give attention regardless whether visual or auditory, they don't give attention at all, right? But with ADHD, not necessarily that they don't give attention, visual attention, sometimes they give auditory attention. All right, so those are the things that teachers can catch on. So that's for at school setting. So when we talk about at home, oftentimes you see when the children or the parents or the caretakers wants them to complete tasks, certain tasks, not just homeworks, tasks like, for example, clean up the bed, clean up your room, or clean up the mess that you made for after you play. So things like that, kids or children with ADHD with its inattention has difficulty trying to complete the task or difficulty in starting the task itself. So those are the things that may be affected. Definitely when it comes to home setting, sometimes socializing skills also affected. When parents are trying to see things, the children probably blurt out things, and that can be considered rude. All right, to certain situations, up to a certain situation, that means that it can be rude. So with that, parent does not understand and apply punishment without understanding that actually that child is having difficulty trying to pay attention, having difficulty trying to do and trying to give his best to give whatever that he can. But the parents are unable to understand and punish it in the wrong way instead of trying to understand things. Yeah.
Okay. Now I see inattentiveness. So now I can see that because sometimes I heard from teachers saying that, oh, this child has difficulty completing homework. They start with something, but they cannot finish. They cannot follow through the task, or they were given something. They are jumping from one topic to another topic. So now, from your sharing, I am able to understand more about inattentiveness, whereby yeah, it does affect them in school because daydreaming is the one that people talk about a lot. The child will be staring at the blank wall or looking outside the window, and then when teachers calling their name, they are not responding, so they'll be like looking somewhere else, looking here and there, where attention is very minimal or it's very short. So this is and also at home where parents found out that it's really to ask this child to do certain task or activity because they just cannot follow through, and or they have difficulty follow instruction. So that's a good point that you bring up, because sometimes I heard that the child are misunderstood in certain way. For example, because of inattentiveness, they are not paying attention. They were given like 5 instruction, they only able to do one, and then they got mixed up, especially if they are given tasks in sequence. First you do this, second, third, fourth, and so on. But they immediately go to the third sequence because that's what they heard, and then they get scolded. But then, yeah, so from there, it makes me clear, like in a way that it's clearer to understand how inattentiveness or inattention or lack of attention affect the child in terms of school as well as home setting. And we all know that, like what Liana shared that just now, how she also shared about how hyperactivity and inattention can affect on the child's social interaction, school setting, as well as other activities that they are engaged in due to not able to pay attention and not able to, just sit through, and then, very impulsive in a way. Okay, and if you have any question, feel free to put in the comment, then I can read it up to Liana. Another question that I have is, because this is, I myself sometimes get confused. A lot of parents ask me about the difference between ADHD and ADD.
Okay, all right. Before I move on to the difference between ADHD and ADD, I just like to add a little bit small portion of the input, right? So when we talk about inattention, sometimes it's difficult to distinguish between normal inattention. Because sometimes children have minimal capacity to give attention, right? So one of the things that you can look out for is lack of memory as well, all right, or difficulty remembering things, right? Sometimes like for example in school, if you send your children to school, now that you guys are going to school, right, children are going to schools, so if the children went to school and have difficulty remembering, like for example left their pencils, don't know where all the
Yes.
stationery is gone through, right? So
Yes.
all that, those things are also important for children to remember to come back with all those things that they brought. So sometimes children, if they do it on a daily basis, means that you already have a pile of stock of pencils, erasers, rulers and whatnot. Already know that, okay, today you don't have eraser, now you have eraser for tomorrow, or tomorrow you don't have pencil and eraser, also come, I give you pencil, eraser. So those are the things that you need to look out for, because it's not common for children to actually just let go. Oh, never mind, just I forgot to bring, then never mind that. You can just replace it. So those are things that you can see if you go back and forth from school. That's one of the things, all right? And then the one you mentioned, Charlie, when you give instructions, you just take, for example, you only give three instructions, right? So you give instruction one, for example, you go to the kitchen and take the blue plate and then take the cup and then put the water and then come back here. All right, so that's several instructions as well, right? So when that happens, sometimes the children with ADHD and with poor attention or inattention, they have difficulty memorizing the sequence of doing that. And sometimes we just take, instead of blue plate, or instead of getting cup, probably just ask, what do you need to do again? What was it? Things like that. All right. And sometimes children also have difficulty listening to instructions. Like say, for example, okay, I want you to go to the kitchen. Zoom, the child is already in the kitchen, not knowing what to do. And then try ask, Mom, what do you want me to do again? Things like that. So
Yeah.
not being able to listen to full instructions, that's one of the things as well. All right. So now let's go back to your question, Charlie. So you want
So
to ask
sorry,
you,
yeah.
yeah,
Sorry, yeah. So the criteria is it has to be the same like hyper activity where it has to be consistent almost.
definitely, definitely.
So
It does
being
not happen once in a while.
all right. So have the tendency to not remember or not recall or forget is also one of the characteristics.
Yep.
Okay. Because I often hear parents saying that a bottle. How can you forget a big bottle every day or like 3 days out of 5 days? How can you leave? How can you left such a big bottle at school and
Yep.
not bring it back? So now I
Yep.
see it. So it's because when we meet parents and talk about their children, and in particular about ADHD, there's so many life example out there. It's just that because I'm not a clinical psychologist, so I'm not uh, really sure what are the characteristics. But when you talk about this, there's so many that I can think of, like the instruction. A lot of parents or teachers feedback saying that I give so many instructions, even it's written on the board, but they still like what? They only manage to execute one or two of the instruction, and it relates to unable to complete given task. So in a way that therefore it's important for parents to know that if your child is diagnosed with ADHD, this is or these are the characteristic of inattention, which is under ADHD. So it's not like they're doing it purposely, or
Yep.
it's not like they're doing just to get your attention, or makes you angry, or they are looking for some sort of a response or reaction, but this is just the correct, or these are just the characteristic of ADHD. All right, thank you for sharing, Liana. So the next one, yeah, the next question, back to our previous question where I have parents asking me as well, which sometimes I got confused. What are the difference, or what is the difference between ADHD and ADD?
All right.
All I can say is this lack of one alphabet.
Yeah. Okay, a good question. Because sometimes parents do ask me, what's the difference between ADHD and ADD, right? So, yes, like you said, they drop one alphabet, the H, right? Means that it's only attention deficit disorder. Means that during the course of the journey of their ADHD part, it's more prominent on the inattentive. So this is the attention deficit disorder, ADD. So it's more prominent on the inattentive part, all right? And the ADHD is with the hyperactivity part, right? Sometimes it's difficult. Children do have or display criteria or features of ADD sometimes, all right? But most of the time, they will present with ADHD first, with the hyperactivity first. As they grow up, they would learn and cope on how to be not too hyperactive or not too impulsive, right? For example, instead of standing up during in class and walk around, probably minor fidgeting, legs and fingers, just want to touch something. Sometimes with pen, click, 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 click all the time. Yes, that's fidgety as well. All right. So that's the hyperactivity part. So as the children grow up, sometimes they lose the hyperactivity in terms of the behavior wise, they lose it, but they will see prominent in the inattentive part. All right. So oftentimes we see that the ADD is usually diagnosed after a while. So it comes with the ADHD and then with the ADD, or sometimes with the ADHD, but more prominent on the inattentive part, but still have features of the hyperactivity part. So that's the two difference between the ADD and the ADHD.
All right. Okay, so meaning that when a child, let's say below 5 years old, they are more likely to the ADHD, which the hyperactivity behavior is more prevalent. So meaning that it's more obvious. So as they grow up, then the hyperactivity behavior reduce. That's why it becomes ADD. But it doesn't mean that they're not hyper. It's just that they learn how to cope with it in a different way, so that it's not obvious. And then, but they also increase in the other side, which is inattentiveness.
And
Okay.
sometimes the hyperactivity lose in their behavior, but they have this rapid thought. So when we say rapid thought is when they jump one topic to the other. Sometimes even when they're not conversing, all right, they have this thinking pattern like, okay, if we want to do in this topic A, okay, I'm thinking about topic A, but suddenly related to topic B and then topic C and then topic D. And then that's where difficulty of endless thinking pattern, all right? Sometimes people with ADHD or ADD gets tired just because of their thinking pattern. Right? They think too much of certain things, but then they have difficulty stopping themselves from thinking about those certain things. Sometimes it affects their sleep. Sometimes it affects their work. We can't stop thinking about certain things, so it affects your work. It's affecting your studies and whatnot. So those are the things. If the ADHD is not presented, the hyperactivity in terms of the behavior is not presented, probably it presented in the rapid thinking pattern. Yeah.
So meaning that the hyperactivity now we are measuring mostly behavior, but as they grow older, it shifted. Instead of behavior, it'll be more on the thoughts,
Yeah.
but it's not presented through behavior. Hence, the H is dropped, but they still have the attention deficit,
Yes.
as well as, but then hyperactivity mostly with the thoughts. Okay, all right. And I also noticed that ADHD is like autism, whereby across the lifespan, like throughout the lifespan of a person with ADHD, it will change and it will sort of like affect them in different ways. Am I correct?
Yes, yes, that's
Yeah.
right. So with autism, the features or the criteria that they have sometimes stick until they're older, right? But with ADHD, sometimes the hyperactivity you lose the hyperactivity in your behavior, but then you retain the inattentiveness more. So when one person retains the inattentiveness, and if they're being diagnosed, means that they know how to handle it, they can cope it well. Okay, they know how to do it, how to cope well, they can able to manage their life. All right. However, for those who are undiagnosed or overlooked at. So these are the part of population that we are concerned with. Why? Because sometimes if you don't know that you can't pay attention and you think that when you can't pay attention, people will say that you're lazy, you don't want to do things, people giving you labels and names and whatnot. And you somehow believe that, oh, I'm actually lazy. I'm delaying things. I'm procrastinating things because I'm lazy. All right. So when you took in that, and then studying makes it difficult for you. When studying is difficult, what happens during your working life, right? So your working life also is going to be affected, where if you can't perform your job properly and you kept on delaying things, so your boss will say things, they will give you warnings and whatnot. So that will be something that is very concerning. And sometimes um, overlooked or undiagnosed people with the ADHD or ADD may develop symptoms of anxiety and also depression, because unable to cope with all these symptoms, unknowing that there are symptoms affecting them, not themselves. Because sometimes they think it's themselves and they blame themselves for having this. Why am I so lazy? Why is it so difficult for me to do this? Why am I not like someone else? Things like that, having negative thoughts over and over again might develop symptoms of depression.
Mm.
I might have anxiety because not knowing what to expect. What if I do wrong this time? What if I make careless mistake this time? So those are the what's the consequences,
Mm.
repercussion after if you're not being diagnosed at an early age.
Okay.
Yeah.
All right. So meaning that if we put autism and ADHD side by side, meaning that autism is less likely to be undetected
Mm-hmm.
because the characteristic is quite strong. The criteria to meet autism is very, very obvious.
Mm-hmm.
If we put side by side with ADHD. So
Yeah.
meaning that now I understand because sometimes when I meet like doctors and whatnot, they have the same concern as you. But for me, I wasn't able to draw the line because I never thought of ADHD can go undetected or overlooked. Now, by you explaining the characteristic of ADHD, it does somewhat uh, it does somewhat uh, look like what a child tends to do, but actually they are struggling. Like being have a tendency to forget, have a not adequate memory. They couldn't really remember or recall events or sequence. So this one will affect them if they are not detected, like you said, or we tend to overlook and brush it off like, this is just, typical teenager, 16 years old, being rebellious, stubborn, but actually it's correct. Some of them, it might be the characteristic of a child, or we can, like you said, it's sad to say, but in our culture or in our background, being in Asian country, anything that have to do with academic or work, if a person couldn't finish, it's labeled as lazy. So it's just a lazy kid, he just
Yeah.
needs some push, then it goes. So now I can see the connection. So from there, a child get it's a repercussion, like you said. So it's one affecting another. So in
Mm-hmm.
the end of when by the time we able to find out if we able to find out the most probably the child or the teenager or the adult has already been experiencing for more than I would say more than few years. So meaning that they have a tendency to have other uh, is it safe to say comorbid.
Yeah, yeah, sure.
Uh,
Comorbid, yeah.
it can be ADHD induced uh,
Induced. Yeah.
other psychological disorders like anxiety, some even builds up depression, okay,
Yeah.
where the most common one we will refer is emotional breakdown.
Yeah. Yes.
Okay, so it's a chain of event. If it go undetected or it goes like it tends to overlook, Okay, all right, that's very interesting. Now I can see the connection because um, I have an experience where dealing with minorities or teenage uh, children. I mean teenagers who are engaged in harmful
Mm-hmm.
activities,
Mm-hmm.
and I can see some of them they do have ADD, ADHD, and now I'm in this field where with you explaining, I can see that they might be labeled as misfit in the school. They are not belong to the school, so they tend to skew out of the education or academic line,
Right.
and they're on their own. Now I can see it's like a big chain of things. Now I understand the concerns that people have on ADHD because okay, to be honest, in this when we talk about special education, a lot of people gonna talk about autism, and then to me, the second big thing is ADHD. But it seems
Yeah.
like the concern of, I mean, they are equally important to be addressed, but
Yeah.
it's just that ADHD at the moment we tend to oversee or overlook. Okay,
Mm-hmm.
right. So talk about diagnosing. So yeah, how do I know if my child needs an assessment or how the diagnosis go about for ADHD?
Right. In terms of diagnosing ADHD, is quite similar to any other neurodevelopmental disorders, right? So if you know that your child have symptoms, right, you can just, if you're unsure even, you can just come for a visit, a developmental pediatrician or a clinical psychologist, just to make sure whether the symptoms presented by your children or whether they are in the typical developmental milestones or within the atypical developmental milestones, right? So there's no harm asking, right? At least you're giving justice to your children. Let's say if the child is needed an intervention or needed some help with the symptoms that they're experiencing, so you're being justice to them. If you don't and you're denying just because you're scared of the diagnosis, I understand receiving accepting diagnosis is not easy for parents to do, but you need to understand that your child is living their life, so they need the diagnosis to help them, because if not, they will have difficulty going through the daily routines, right? So um that's why it's important for parents to actually bring up their children, just to look at whether it's something needs to be done or not. If it's not, then what can we help to for the children, all right? So in terms of diagnosing, if you notice atypical behaviors or you're not sure, just come by, we'll see, we'll ask questions. So some of the assessment that we use are corners, all right? So there are a lot of um, other assessment tools, right? So we have most of the time I use ADHDT or corners, all right? So for corners part, we would have to ask from three parties to actually do it. For example, if the child is 8 years old and above, understanding verbal instructions, then they would have to do a self-report, or reading comprehension. They would have to do a self-report, or sometimes if they have difficulty reading, sometimes we can just read out to them, where there are a lot of questions just to differentiate between one behavior to the other, and that's for self-report corners. And then we have questionnaires for parents as well, throughout their observation, what can they observe at home, whether they can see the behaviors at home, outside when maybe they're at the mall, relatives place and whatnot, and at school, what's the difference, right? So self-report, and then parents questionnaires, and then the last one is for teachers. So sometimes we give out to teachers just to make sure whether, because sometimes teachers, they spend a lot of time at school with the children, right? So we would ask teachers to fill in those questionnaires. So we take from the three perspective, all right, so that we know we can cross check those informations, and we can see the scoring whether it's validate or not. All right, so the validation is important, whether sometimes parents see certain behaviors as an extreme behavior, but it's actually within the developmental milestones, things like that. So we need to have a cross-check information. So that's one of the things after we do an assessment. All right. Sometimes during the assessment with the parents, or during the intake interview with the parents, um, we can actually observe the children stuff, whether the children is able to stay still, whether the children is moving around in the session, in the room, climbing up the sofas and whatnot. Sometimes if during my session I would see children, because I have a sofa in my room, so I would see children going around, jumping on the sofa, climbing off the sofa. Sometimes they just want to see what's outside at the window and whatnot. So those things I would say, like, okay, while doing the interview, I would say, is this a normal behavior at home? All right. Aside from doing this at home, this behavior applied in elsewhere. Like, say for example, if you're in relatives' home, does that happen as well? Those are the things that I can catch on. All right. During the intake interview itself. So basically, I'm doing the intake interview. I'm doing observation as well. I'm doing the cross-checking information as well. All right. So that's why it's a lot easier, and it's more helpful for the clinical psychologist if the parents could bring the child along with during the session. That's one thing. And if it's possible, without the siblings, because sometimes the siblings trigger the certain unwanted behaviors and whatnot, and we don't see the proper or the true behavior from the child itself, right? So sometimes parents also get confused, like, okay, no, this is only happens when the brother or the sister, triggers him, disturb him, things like that. So we have difficulty, and we have a lot more questions, like, okay, without, things like that. So try to reduce the possibilities of that happening. The factors can interfere or interrupt the session is just to bring the child itself with both parents attend. Yeah. So after a while, after the assessment is done, with the observation is done as well, then we have a 2 weeks or a brief report briefing. So that's where the report briefing is done, and we explain to the parents, okay, if the child does not have ADHD but have a difficulty with the behavior, why is this happening? So we would explain to them as well, right? With those who don't have ADHD. But with those who have ADHD, we also will explain, okay, according to the assessment that we did, there's cross section or cross information that's done. Teachers reported this as well. You have been reporting this as well, and the children also has been reporting this as well. So all these are synchronized, all right? All the information are cross-checked, and that's where the diagnosis is being given, all right? So that is everything that's being explained, and the recommendations as well. If the need for the children, because sometimes ADHD could interfere with the academic skills, right? So we see uh, whether that can be replaced instead of a mainstream school to a special needs school, or what needs to be done in terms of the environmental factors. So those are the things that we do in terms of diagnosing.
Thank you very much, Claire. That's a very compact information. Just a reminder for parents that are tuned in to our Facebook Live, please do not self-diagnose. I know that now we have internet, we can get many information almost immediately, but please do not self-diagnose. Check out your nearest clinical psychologist or pediatrician or developmental pediatrician just for a chat if you hesitate, and then ask as much as information about ADHD if you suspect your child to have one. Why? Like we have explained just now about inattentiveness and hyperactivity, we tend to overlook or over exaggerate sometimes. So we need someone like Liana, which is who is a clinical psychologist with experience. So then they can help us to identify if it's really a characteristic of ADHD or not. Because for self-diagnosing, whatever it's written in the information is in the internet, is like reading a storybook. So we can almost immediately relate, but we have to know the duration or the how often or how long has this been going on. But we are not trained to do so. That's why we go to even psychiatrists can do that. So check out your nearest mental health service provider or a doctor like pediatrician to find out more. Okay, so basically what Liana shared is really good. She what to prepare is like she's shared, there's so many assessments. So you can check out your local clinical psychologist. Like Liana shared that she used ADHD as well as corners. The difference is that corners, they require three different settings: school, home, and also clinical observation. She also did mention how long is the assessment. It takes about 2 weeks also to produce the report, because there's a lot of process that she need to go through with. She have to go through, she interview the parents, observation, observe the kids at the moment, at the same time, as well as cross-check with the parents as well as school. So these are the things that you can prepare if your clinical psychologists are doing corners for ADHD. And then she did also share the process. First, she'll do a clinical interview. So while doing the clinical interview with the parents, she can also observe the child. Okay, and then the stakeholders who are the one that involved during the diagnosis, uh, parents and the child, if possible, so that she can do uh, observation as well as the interview. And then the challenges for the clinical psychologist is if the child has a sibling, it's preferably the parents come with just the child. Why? Because the siblings have a tendency to, provoke this another siblings, and we can't really see uh, the nature of such behavior, because it was a chain from, it was caused by something uh, 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 by others. Okay, it's not really from the character, or it's not really coming from himself, but it's triggered by something else. Okay, so by listening to her explanation on the diagnosis, this is why I highly suggest parents, or highly recommend parents to not self-diagnose, because it's not an easy process. When we read, it can be as easy as reading. Okay, but when we apply, it's not that easy. So if you do it by yourself, you might get misjudgment or misunderstand the characteristic. And then another part that Liana also covered, the last bit where I want to ask, which is what's next. Okay, she mentioned that after all the assessment has been done, there's a yes and no. If yes, your child has ADHD, then she will recommend what to do therapy, or if the school is suitable for your child, or maybe a special attention, or maybe we might consider moving to a special needs department, or special needs, or a school that provides special needs education. If it's no, then she also will explain why such behavior occurs. So there's a very fine line, like she shared just now. Some behavior can be like, we tend to overlook, but some is really the characteristic of ADHD. So this is why it's very important for us to see or to seek help from a professional, because they know the difference. Okay, so we rely on them to have a very valid report. Okay, all right, we are almost at the end of the session. Anything that you want to add on, Ms. Liana?
Yeah. One thing I would also like to add is that sometimes when children are not, the criteria is not sufficient enough to diagnose as ADHD, but the behaviors are towards or inclined towards the ADHD part, right? Sometimes I would also ask parents to go and check with the OT, occupational therapist, because sometimes it's because of the sensory issues, right? Understimulated children would want to stimulate themselves. So sometimes they engage in certain behavior, experimenting with hot things, experimenting with different types of textures, wanting to do a lot of activity just to stimulate their own senses. So sometimes that can be misunderstood as ADHD behavior, but it's just them being under stimulated or sensory issues. So that's why also sometimes I also recommend them to go and check with occupational therapy as well. I think occupational therapy or OTs would have to better explain this part rather than myself, right? But those are the things, some of the things that I looked at as well, just to get suggestions from the OTs. Yeah.
All right. Any take-home messages for the parents that joined today?
All right. Um, Regardless whether your child display symptoms of ADHD or autism or SLD, or SLD is specific learning disorders like, for example, dyslexia, dyscalculia, dysgraphia, or also with ID is intellectual disability. All right. So regardless whether your child is presented or have criteria of those neurodevelopmental disorders, symptoms of those, please bear in mind that it's not a bad thing for you to get them checked, because it is actually a benefit and an advantage for you, because you would understand their behavior rather having to figure out what's happening with my child or children at home. Why are they behaving this way? So you would have a lot of questions in your head, rather than it's best for you to just approach a professional and see, just to get them checked and understand their behavior. What is this behavior, or why does this come from? All right. I also understand that the fear of having diagnosed with a certain diagnosis, right? So I know it's not easy. I understand it's not easy. I have difficulty also to break the story to them, right? When I want to report them, I would always make sure that, are you ready for today's report briefing? What is your expectation for this report briefing? At least I know where they're at. If they are scared, at least I know how to break the story to them in a more kind of way, or more
Mm,
subtle way. But if they are ready, I would just go straight forward, right? Direct to the point, saying that, okay, it's good that you actually know. So this is what happened. So this is, I know I would explain details and whatever. If not, I would have to consult the parents and, take things one step at a time and ask them. I want them to ask more questions if they don't understand. Like, say, for example, if I say ADHD, I would sometimes, now, do you understand what ADHD is? So I would just want to get those information checked. If you don't understand, and if they don't know what to ask, I would just explain what are the important parts that they need to know for the later part, right? So seeing a clinical psychologist, seeing a child psychiatrist, seeing a developmental pediatrician is not something to be feared of. It's something that you need to be prepared with to handle your children better at home. Yeah.
yep. Yeah. Or I 100% agree. Like I said just now, it's simple as going to the internet and look for the characteristic of ADHD. But I also want to let parents know it's also very simple to just put in the health professionals that know about ADHD in the internet, and you can find uh, who are the legit professionals, okay, and who can deal with ADHD or who can diagnose with ADHD, because it's as important as you look for information about ADHD. Why? Because from my experience, a lot of articles are written not in the context of Malaysia. So most of the specialists mentioned in that article cannot be found in Malaysia. So if you can spend some time looking for information about ADHD, I would recommend parents to look for health professionals that work with ADHD in Malaysia context. So from there, like what Liana said, whatever that you don't understand or you read from the internet, you're not sure, you can just look for health professionals and they can provide the answer for you. All right, we are already at the end of the session and there's no questions so far. So if you have any question, feel free to comment even after the Facebook Live. We will try to answer the comment. So, and again, today I would like to thank Liana. Thank you, Liana, for spending an hour with me this afternoon to share your knowledge about ADHD. I'll see you on the next workshop.
All right, Charlie. Thank you so much
Yeah.
for having me.
All right. Bye bye. Have a good
Bye.
evening.
Bye, everyone.
Bye.